All right, we'll be live in 5 seconds. Hi, everyone. Welcome to today's webinar. We're going to give attendees about 60 more seconds to log on, and then we'll get going with today's formal presentation. Hi, welcome if you're just joining us. We're just going to wait a few more seconds while we give attendees a chance to log on, and then we'll get going here shortly. All right, let's get going. Welcome, everyone. My name is Pam Purnell, and I'm the Territory Manager for the Prairie Provinces. I want to thank you for joining us today for our webinar on the topic of the NutrEval applied to clinical practice. The NutrEval profiles will be available to order starting on September 8th. The NutrEval Plasma is one of the most comprehensive nutritional profiles available, assessing a broad array of macro and micronutrients, as well as markers that give insight into digestive function, toxic exposure, mitochondrial function, and oxidative stress. The NutrEval profile includes 5 distinct sections. Together, they provide a comprehensive look at the patient's nutritional status. Over the next hour, we will discuss the components and options of the NutrEval and apply the NutrEval to a case study. Before we get started, I'd like to address a couple of housekeeping issues to ensure you get the most out of this webinar. Should you have any questions today, please enter them in the Q&A function at the bottom right-hand side of your screen. We will have a question and answer period at the end of the presentation and try to address as many questions as time permits. If we don't get to your question during that time, please know that we will be following up with each question after the webinar as well. Just a reminder, you need a Genova sub-account to order Genova tests with Rocky Mountain Analytical. If you've not signed up yet, reach out to your territory manager who can assist you in getting a sub-account. Additionally, if you want handouts of the slides, they can be accessed through the webinar's landing page. Go ahead and download them and feel free to print them as well. With that, I'd like to introduce our speaker, Dr. Stephen Goldman. Stephen Goldman, DC, has a Bachelor of Science degree from the University of Massachusetts and a Doctorate of Chiropractic from Cleveland Chiropractic College, where he also served as a member of the faculty. He was in family practice for 25 years in Los Angeles, where he worked largely with the athletes and patients concerned with optimal health before relocating to Asheville and joining the medical education team at Genova Diagnostics. As a medical education specialist, Dr. Goldman provides educational support to physicians and also authors medical education support materials. Dr. Goldman, I'm handing the presentation over to you.
Thank you so much, and welcome everyone. It's great to have you back again. This is my second opportunity to speak and go through one of these tests. Today we're going to be looking at the NutrEval, a nutritional evaluation, which is our most comprehensive nutritional evaluation. It has a lot of component parts, so I am looking forward to going through them and answering your questions as we go. I am, as was said, in Asheville, North Carolina, sitting at my desk right now, going through this, and very excited to answer your questions and to talk about the NutrEval. So as we look at this NutrEval, the objectives for this presentation are to review the components of the NutrEval. It has several moving parts that we're going to look at individually, to discuss plasma versus amino acid options. In other words, there are 2 types of NutrEval, and the only difference is going to be the option around amino acids, either a first morning void or a plasma, and we'll look at the differences there as well. We're going to review a case study so that we can really apply the test and see how all those working parts move together to provide us with information in terms of how to design a test as specifically as possible in terms of nutrient needs. And we'll demonstrate the use of the website for resources. And I added this because there's so much information on our website. And oftentimes doctors aren't aware of it or how to get to it. So I'm going to show you that. And I will tell you a little inside baseball here is that they literally changed something on the website to make it even better yesterday. So I frantically had to come back to my PowerPoint and update those slides, but they will be the most recent changes that allow for interpretive guides and the like that I think you'll find excellent resources. So we're going to look at the various NutrEval components first. The first page of the NutrEval is this NutrEval results overview, and we'll look at this again later. But I think it's a good opportunity to talk about my point of view. When I look at a NutrEval, since it does have so many different parts, I'm always looking for patterns. And so this front page, this results overview is something that I use to get a sense of what are the headlines, what is this test telling me? And then the next page is the suggested supplement schedule that provides us with even more information around that. And then we have our interpretation at a glance. This is the only interpretation at a glance slide, so I'm going to stop here for just a second because it does provide some information as far as talking to the patient about the findings. So in this test where vitamin A was in a moderate need in yellow, based on where that black X is, we can see the recommendations and various points of interest to discuss with the patient. What is vitamin A? What are the causes of a deficiency? What are the complications? And the purple arrow at the bottom, which are food sources. And I'm a big buyer of the idea of food sources are really a great way to get your nutrients. And then we have the Kreb cycle at a glance. And we'll talk about this. I know when I talk on the phone about the Kreb cycle, doctors are either very excited to dig into this, or I hear a little sigh of, oh, I have to learn the Kreb cycle? Well, it's very exciting information, in my opinion. And then we have the metabolic analysis markers. These are the organic acids, and we're going to look at the various headings of these because organic acids really provide a lot of information about a lot of different areas. And then the amino acids. This amino acid is a plasma. We'll also look at what the amino acid first morning void urine looks like. Very, very much, very similar. And then, of course, the essential and metabolic fatty acid markers from red blood cells, where we look at things like omega-3 fatty acids and omega-9 saturated fats. So we'll dig into that as well. And then finally, the oxidative stress markers, as well as the elemental markers, so nutrients and toxics from blood. So those are the components. And as I said, there's a lot of working parts here. So that brings me right back to that point in regard to looking at patterns. So when I look at this front page, what I'm looking at are what are the headlines? And you can see we have antioxidants, B vitamins, and minerals. This column that's normal in green indicates that when the algorithm looked at the markers of the test, everything from vitamin A to zinc looked very good. So when we get to the supplement schedule on the next page, those marked in green would be really the minimal amount of supplementation one would consider, whereas the borderline would be yellow from vitamin C through B2 here, a more borderline to moderate recommendation, and we'll see that in the dose recommendations reflected there, and then the high needs in red. And so I step back here and I say, well, what are the headlines? Well, as far as antioxidants, a moderate vitamin C and alpha lipoic acid make a moderate antioxidant need a headline. And certainly as well for the B vitamins, even more so. So a number of high and moderate needs for B vitamins make this a very big headline for this test. The minerals really look pretty good here. So we expand on this on the next page. So this is the suggested supplement schedule. And just to get a quick look, here again are the antioxidants, the B vitamins, the minerals, but we also add the essential fatty acids, digestive support to this. Now, there are 3 columns here. The first is the daily recommended intake, or DRI. To be transparent, I don't spend much time on that. It's the U.S. government's minimal recommendation, kind of how much vitamin C to prevent scurvy. And so I don't suspect it's going to be something that's very important, but it does provide a sense of proportion. And I say sense of proportion versus the patient's daily recommendations that you see here. These are the recommendations based on the algorithm in the green, yellow, and red configuration. And so if I look at this, I can see that for antioxidant needs, there's some moderate needs indicated here, green and yellow. When I look at the B vitamin needs, there are those high needs and the 2 moderate needs. And so those are all going to be noted. But I also noticed that here, and not on the first page, is a moderate need for pancreatic enzymes in yellow and a high need for probiotics. So the gut would be another headline that I would add. So, and by the way, while we're here, the essential fatty acids, there is an omega-3 yellow recommendation as well that's not on the front page. So now I have a sense of what the various headlines are. Notice, though, that our recommendations tend to be conservative. You're seeing the patient face to face. You may feel like a high need for niacin. We're saying 50 milligrams. You might say, hey, this patient could use 75 milligrams or 100 milligrams. That's why we have this provider daily recommendations column. This is yours, because this is where you would pencil in any differences, any things that you want to change. Again, you're seeing the patient face to face. And that's why it's important to really remember that this column is there for you. Now, all of what I've talked about up to this point has been based on an algorithm looking at the various markers and coming up with these recommendations. At the bottom of the page, you'll notice that there are amino acid recommendations in milligrams per day. These are based on the direct measure, whether from first morning void amino acids or if you choose the plasma amino acids, as far as the recommendation. So you can see there's the arginine, the glycine, but I would also say that I always hold off on making recommendations just based on this until I get to the amino acids page. Because again, there are patterns that reveal themselves on that page that can influence my plan, my protocol for that patient. So up to this point now, we have the front page, we see headlines. We have the second page, the suggested supplement schedule. We see further information and specific recommendations. And then the interpretive glance that I showed you initially to be able to discuss that with the patient in the report of feeding setting. So that takes us to the organic acids, the MAP, the metabolic analysis profile. And the thing about organic acids, first of all, before I even get into this, I'm a big believer. What's the big picture? What is an organic acid? Why do I care? Well, first of all, remember, organic acids are not nutrients. They're made from nutrients. Nutrients are things like quercetin and flavonoids, lignans, and amino acids very often. And those nutrients go through a number of different pathways, metabolic pathways in the body. And as they do that, they're altered by enzymes, maybe by bacterial activity in the gut. So as nutrients are altered, they become metabolic intermediaries. And that's what organic acids are. They're the metabolic intermediaries. And so the reason they have value when we look at a test like this is we can get a sense of very specific pathways based on changes in the intermediary metabolites. So the organic acids. And that's why we can look at malabsorption and dysbiosis specifically, because these are organic acids that are impacted by anaerobic bacterial activity in the gut. So if we see an elevation, for example, of DHPPA, I know that that starts off as an amino acid, actually 3 of them, tyrosine, tryptophan, phenylalanine, that in the gut are converted by specific bacteria into DHPPA. So this elevation clues me in that maybe there's dysbiosis, an imbalance of those bacteria. And that's what we're looking for. So these categories are based on knowing specific organic acids from specific pathways. So the next one here would be the neurotransmitter metabolites. Now, the neurotransmitter metabolites I find very interesting are, again, about pathways. So there's a pathway, for example, whereby tyrosine, an amino acid, again, is converted into dopamine. And dopamine gives us focus and calm. And then dopamine makes homovinylic acid. But dopamine also goes down the pathway to make norepinephrine, epinephrine, adrenaline, and then finally vinylmandelic acid and 3-methyl-4-hydroxyphenylglycol. So I'm looking for balance here. And by the way, bear in mind, the width of the yellow is the reference range. The green is the more populated, generally the one standard deviation, a good place to be in the reference range. Another pathway here is that of tryptophan, another amino acid that makes 5-hydroxytryptophan, which we often give our patients, and that makes serotonin, predominantly in the gut, but also in the brain, 95% in the gut and some in the brain. But the metabolite of serotonin is this 5-hydroxyindoleacetic acid. So that elevation could speak to gut issues. That elevation could also speak to stress and an upregulation of serotonin. Now, at this point, you're probably saying, that's a lot of pathway to remember, and that is why we have this. So this is so you can look back and see these pathways. Again, tyrosine, which, by the way, also makes a thyroxine, making dopamine, and then the offshoot homovinylic acid that we measure, as well as the norepinephrine, epinephrine, adrenaline, normetanephrine, and the 3-methyl-4-hydroxyphenylglycol and vinylmandelic acid. So we're looking at these organic acids to get a sense of balance. And then the serotonin metabolism. The tryptophan in the adrenal, the medulla is where these catecholamines are made. The serotonin, tryptophan to 5-hydroxytryptophan to serotonin, which does not cross the blood-brain barrier, so 95% made in the gut for gut motility, about 5% in the brain, and then the offshoot, melatonin production and the 5-hydroxyindoleacetic acid. So we're looking at these organic acids to really get a feeling for these pathways. So again, here they are listed. Now, another aspect of tryptophan is that under high stress situations, you have an offshoot pathway here that I didn't demonstrate, where with high cortisol, systemic inflammation, toxicity, oxidative stress, tryptophan will make a metabolite, an organic acid called kynurenic acid, which is protective, but tells us about issues of possible ox stress and inflammation. And that offshoot to that metabolite is quinolinic acid. So I just wanted to go through that because you see that here. So here is that kynurenic acid. So when you see an elevation like this, we know that 5-hydroxyindoleacetic acid is a byproduct of serotonin metabolism, but that under stress and oxidative stress, kynurenic acid and inflammation, which is protective, can elevate. Now, if kynurenic acid converts into high concentrations of quinolinic acid, that's even a bigger problem because quinolinic acid is a neurotoxin and it's excitatory to the nervous system, and over time can cause brain cell damage and cognitive issues. And that's why we look at the kynurenic quinolinic ratio. An elevation of that ratio is a good thing. We have the more protective kynurenic acid being made. If that were reversed and we had more quinolinic, that's a bigger problem, and you would see this number move to the red. So here we have the vitamin markers. And the way this works, the way this functions, the principle behind it, for functional recommendations of B vitamins, these organic acids all must have specific B vitamins in order to be broken down. If they don't get those B vitamins and don't get broken down readily, they accumulate in the blood and they get dumped into the urine. And when that happens, you have an elevation in the urine, and that's what the algorithm is looking for. So if aminoglutamic acid or FIGLU is elevated here, folate and somewhat also B12, but folate especially, is needed to break down FIGLU. So when we see an elevation, that implies that there is a functional need for folate. the algorithm looks at these kinds of findings to provide recommendations, functional recommendations for B vitamins. And then we have the toxic and detoxification markers. Whoops, there we go, toxin and detox markers. This is about exposure. So alpha ketophenolacetic acid is from styrene. You see it elevated here, styrofoam, plastics, people that use plastics in their microwave, but even exhaust fumes from automobiles, and alpha hydroxy isobutyric acid from MTBE, which is sometimes used as a gasoline additive to lower emissions, but in the US at least has gotten into the water table. And as a result, one can, through mostly water and sometimes soil, like in a plant-based diet, if there's contamination of the water and or soil, have higher levels. Often recommend filtration at home, for example. When I see a high MTBE, a carbon-based filtration system can be useful. These are water-soluble, so they won't be stored in adipose tissue, but hydration and detoxification become really important there. Orotic acid looks good here. It can elevate sometimes with liver issues, and pyroglutamic acid is both a precursor and byproduct of glutathione, which we'll talk about. So that takes us to the cellular energy and mitochondrial metabolites, or the Kreb cycle. So I just wanted to spend a little time on this because I think it's really important to get a feel. You have carbohydrate metabolism, you have energy metabolism, you have fatty acid metabolism. But really, when we look at this Kreb cycle, what we've done here is we've taken these organic acids that are part of that cycle, and we put them, overlap them on a pathway chart. And the idea, as we've seen already, is to find imbalances. Where we see imbalance of the organic acids, we think about what are the nutrient cofactors that support that. So we know that in the mitochondria that proteins, the macronutrients, proteins, amino acids, carbohydrates through glycolysis, making pyruvic and lactic acid, and fats as fatty acids oxidizing, all go into the mitochondria to make acetyl-CoA. And then the acetyl-CoA goes through that cycle to produce energy. Now, we look at these in variation to get a sense of what are nutrient cofactors that may be a problem. So here are the citric acid cycle organic acids, and we're looking again for imbalance. So if we look, for example, at carbohydrates converting to pyruvic acid for glycolysis, the green circles contain those cofactors that need to be there adequately. So if I see a low pyruvic acid, I'm wondering, is my patient on a low carb diet? Or do they maybe need magnesium as a nutrient cofactor functionally to upregulate that glycolysis to pyruvic acid? If I see an elevation of adipic and or suberik acid, it tells me fats are not oxidizing well and therefore may need carnitine and magnesium as cofactors to help with fat oxidation. You'll see this in patients with fatigue, for example, who aren't utilizing fats adequately for energy production. And if pyruvic acid is very high, it would need these various cofactors, because without these cofactors, pyruvic acid can't convert to acetyl-CoA, and it may back that up. But another thing that can get in the way would be what's in the red circles. The red circles contain, in this case, arsenic, mercury, antimony, toxics that, when elevated, can create a blockage. So that's how we look at this chart to get a sense of what nutrient cofactors can balance this out. But remember, too, the algorithm is going to make recommendations for us. Now, I mentioned earlier about amino acids as first morning void and plasma. So this is the first morning void, and it provides a distinction here of cysteine and cysteines. I'm going to go through some of the differences between first morning void and plasma, because, again, there are two types of NutrEval. There's the amino acids from first morning void or plasma. That's the only difference. So when you order a kit, you want to know which one of these you want. This is a first morning void. And one of the things that's different is it separates cysteine from cysteine, which is good because higher cysteine is an indication of oxidative stress. So that might be something that you prefer. The first morning void provides 2 more dietary peptides, the anserine and carnosine, which can be helpful, but we do get the 1-methylhistidine and beta-alanine on the plasma, and anserine does convert into 1-methylhistidine. So it's not unusual to see this low, but this high because the conversion has happened, but you do get these 2 on first morning void. And first morning void reflects the most recent protein intake. So I think, the biggest difference for me is if I'm looking at a first morning void amino acids, I'm seeing a reflection of amino acids based on the most recent meal or 2 that the patient had, that the protein levels. Whereas if I look at the plasma amino acids, it's more of a steady state amino acid level based on dietary intake for maybe up to 3 weeks. So I tend to lean in that direction sometimes because if I want to see a longer term level, I find that helpful, but both are very good tests. So here you see those 2 dietary peptides, and cysteine is combined between the cysteine and cysteine combined together. That's why it's given us as cysteine combined with the parentheses. So when I look at the amino acids, as I said from page 2, I don't immediately say, oh, you say I need some glycine, I need some, some histidine. I want to look at patterns. I want to see the page first. So what's the pattern? I look at the nutritionally essential amino acids. Remember, they're nutritionally essential because they come from foods. And here I draw a plumb line right down the center, and I say, what's the pattern? To me, the pattern is moderate. And then the question becomes, if it's moderate, are they eating a moderate amino acid diet, which means they're doing well, or even a low protein diet, which means they're doing very well? But what if they're on a paleo, high protein diet? I would expect these numbers to be shifted to the right. So the question again, if I have a moderately nutritionally essential amino acids pattern, what's the dietary intake like? And that's where 1-methylhistidine is very helpful because it tends to provide insight into dietary intake of protein from fish, from fowl, chicken, duck, turkey, and from meat. So in this case, I would say they're consistent. We have a moderate 1-methylhistidine and a rather moderate pattern of essential amino acids. Now, I also look further up at the 3-methylhistidine, which comes from muscle fibers, the muscle fibers, actin and myosin. If somebody's working out with weights and tearing down muscle and replenishing it, it'll go up. If somebody's catabolic and breaking down their own muscle, it'll go up. But also, if somebody's eating red meat, it'll go up as well. And I also like to keep an eye on the urea level from the urea cycle, because when I see a higher urea level, that typically reflects a pretty reasonable amount of dietary intake of protein. And I couldn't resist because it really stood out, this ethanolamine to phosphoethanolamine, this big difference. This is from a pathway of serine converting to ethanolamine, to phosphoethanolamine, to choline and acetylcholine. And I pointed out because this is a very magnesium-dependent step. So when I see a high ethanolamine and a much lower phosphoethanolamine, functionally that speaks to a need for magnesium. Now, the essential metabolic fatty acids are from red blood cells. And so I'm always going to first look at these omega-3 fatty acids and get a sense of it. And I noticed that the alpha linolenic, is a bit low. That's interesting. Maybe they're supplementing EPA, but there is a way of getting a sense of the overall need, and that's the omega-3 index that I circled here. The omega-3 index in the literature speaks to an ideal balance between 8 and 10 here. At 6.9, however, that's not bad. You have to really work hard sometimes to get to that 8 to 10. So really not a bad finding overall. Now, the next thing I like to look at are the omega-6s, because omega-3s, if they're low, that's pro-inflammatory, but a low DGLA is also pro-inflammatory. Most people focus so much on the arachidonic acid, which when elevated is inflammatory, that they forget that there's a very strong anti-inflammatory in the omega-6 group. So I don't want to miss that. I noticed there's a high percentage overall of saturated fats, which makes me want to look at their diet. Now, I mentioned this omega-6 family. This page, I think, is very useful. So you start off with the linoleic at 15.3. Through delta-6 desaturase enzyme, we get this gamma-linolenic, or GLA, which looks pretty good here, moderate, but it is a drop from the linoleic, so it makes me wonder about that delta-6 desaturase. But then the gamma-linolenic converts into the DGLA, which is the dihomogamma-linolenic, that anti-inflammatory that I spoke of. So when I see that low, that's a concern. How do I increase that? Well, it's got to come from the GLA. So if I have a low GLA, I'm going to be thinking about things like evening primrose, borage, blackcurrant to increase this. But I'm also going to look at the elongase cofactors, because if GLA is not converting well to DGLA, here are some of the nutrient cofactors that are going to be responsible for trying to upregulate that. And also here you have a low arachidonic acid. As I said earlier, a high arachidonic acid is considered pro-inflammatory. However, a low arachidonic acid is not necessarily a good thing. There are qualities such as a cell viscosity that come with arachidonic acid. So my goal on this page really is to have DGLA in the green, so I'm getting that anti-inflammatory benefit, and then arachidonic acid more moderate than this. So there are times when you actually want to increase the arachidonic acid. And the next section that we're looking at here is the oxidative stress section. So for oxidative stress markers, what you're seeing here is glutathione, lipid peroxides, 8-OHDG, and CoQ10. So the glutathione here is in the yellow. Now remember I said earlier that the green and yellow combined are the reference range. To the left, the red is low, and here with the lipid peroxides to the right, it would be elevated outside the range. So bearing that in mind, there are times you really want to be in the green. And I would say that holds true for glutathione and lipid peroxides and 8-OHDG. So in this case, for example, the glutathione's in the yellow. That speaks to a need as far as glutathione. So perhaps this patient is already depleted for nutritional needs. Perhaps they have some toxicity that they're addressing. But certainly that would get my attention as far as antioxidant support. And it would also get the attention of the algorithm and recommendations on the first 2 pages. Now, the lipid peroxides here you see are in the yellow. So when I see that, lipid peroxides are measurable oxidative stress damage, oxidative stress of lipids. So you think really of oxidation of cell membranes. And you'll see this. You'll see this in athletes because they push the envelope a lot. But you don't, again, want to be in the yellow or red. You want to really maintain this in the green, because otherwise you have measurable oxidative stress. As I said, oxidation of lipids. The 8-OHDG here actually looks very good at 2. It's in the green. 8-OHDG is a different kind of measurable oxidative stress. It's actually in the cell nucleus where free radicals create damage to DNA. And so a high 8-OHDG would also, 8-hydroxydeoxyguanosine, would be indicative of an oxidative stress issue. So the lipid peroxides here get my attention, and the glutathione gets my attention as well. And then we have these elemental markers, these nutrient elements, copper through zinc, and these toxic elements. Now, just bear in mind, these are direct measure, and you see plasma, RBCs, whole blood. And so you can get a look at that and see. But there are going to be times when the algorithm will see a normal magnesium and still recommend a moderate or high need, because the algorithm will give the magnesium the most leverage in its recommendation. But as we saw with the ethanolamine, the phosphoethanolamine, or the carbohydrates in glycolysis, there are other pathways that need magnesium that can increase the algorithm's recommendation. When we talk about the toxic elements, we're looking at exposure, and these are all whole blood exposure. So if you're in the yellow, you're in the reference range, but in the red, you have an elevation to address, an exposure to address. So that's a walkthrough And there's a lot there, a lot of sections. So again, I would emphasize looking for pattern analysis, looking at each section and then tying it all together, which is a great advantage of having the algorithm help with that. But it's great to also get to know the test very well. And there are resources that we'll look at in a moment. But let's look at this case study. So here we have a 42-year-old female. She complains of intermittent postprandial constipation with abdominal discomfort. So she eats a meal, she gets abdominal bloating, and she complains of constipation. And she has difficulty gaining weight. We would describe her as thin and frail. Chronic use of antibiotic therapy for gut issues in the past. So it really makes you wonder about her gut microbiome. She has a light appetite and very little meat or protein dietary intake. Her stress is reported as high, but no consistent exercise protocol is reported. She feels tired. She has difficulty sleeping and has a lot of muscle aches. She hasn't had a cycle for the past 6 months. And medication, she's just really on a multi-mineral. So as far as the NutrEval findings for her, remember, I'm always looking for patterns. And so when I look at the left here, that front page, remember, antioxidants, B vitamins, minerals. What are my headlines? Remember, too, the green means that the algorithm said really low need, yellow borderline to moderate, high need in the red. So are antioxidants a headline for this patient? Well, yes, moderately so. A moderate need for vitamin C, a moderate need for alpha lipoic acid. I think the B vitamins really stand out here. And that's so important. When I see low B vitamins, it makes me also think about things like methylation, detoxification, energy production in the Kreb cycle. So a lot going on there. We see also under minerals, the zinc need. Although based on our clinical presentation, I also think even though the magnesium here is in green, I may, again, because I have my provider daily recommendations column, I may bump that up a little just based on the patient and the presentation. So what about the gut? Well, here we have the digestive support on the next page, and we see that there was a moderate need in yellow for probiotics. No indication of pancreatic enzyme need. Interesting. Here are the recommendations from the test. Notice too the omega-3s. They look okay here. And I would fill in any changes that I deem necessary here. And then, of course, I have the direct measure of the amino acids. Wherever you see 0, that means we're not recommending supplementation, that they're past the low 25% of the reference range. But you can see there are a number of different needs here. As I always say, when I get to this section, I'm going to hold off until I see what the amino acids look like. And then I have the organic acid section. So let's take a look. So what about the gut? Malabsorption and dysbiosis markers. Well, under bacterial dysbiosis, I see a high 3-hydroxyphenolacetic acid. So here I have an organic acid that is elevated that may speak to really malabsorption as well, but certainly the possibility of dysbiosis. Now, there are also foods that can influence this, and they're listed in the interpretive guide. So bear that in mind as well. Things like grapes and black tea can elevate 3-hydroxyphenolacetic acid. So I certainly want to ask about that. And in addition, under the yeast fungal dysbiosis markers, the citramalic acid is a little bit on the high normal side. Citramalic acid can be made by bacteria or yeast, so it may be an issue of bacteria or yeast support. But this section, this malabsorption dysbiosis section, is really going to be where that moderate probiotic recommendation is coming from. Next, we have our neurotransmitters. And so when we look at the neurotransmitters, remember we had those pathways. Here we have that 5-hydroxyindoleacetic acid elevation. Remember, we go from the tryptophan to 5-hydroxytryptophan to serotonin, mostly in the gut. So this elevation could speak to more gut support as far as the need for gut support, but also may speak to the stress and the upregulation of the metabolism of serotonin. But remember, too, that tryptophan under stress can go down an alternative pathway to make kynurenic acid. And kynurenic acid is protective and does, by the way, need B6 to be broken down. But high kynurenic acid may be, to me, more like the alarm clock. It is protective, but protective against things like oxidative stress and inflammation, high cortisol. Notice the quinolinic acid here looks actually pretty good, and the ratio looks very good. So I'd be even more concerned with an elevation of quinolinic acid. That's the toxic. However, that high kynurenic acid speaks to the possibility of inflammation and oxidative stress. So I'm going to certainly consider that when I design my protocol. Next, I have my B vitamin markers. Some of these in the yellow are going to be part of the algorithm. And there are other recommendations in the algorithm around that, because as you recall, there were a number of B vitamin recommendations on the first 2 pages. For the toxin and detoxification, I noticed the alpha ketophenolacetic acid from styrene is a little bit on the high normal side, but the rest of these look, I think, really pretty good overall. What about the Kreb cycle? Well, the Kreb cycle here, we can see that there are some issues. We see, for example, from carbohydrates to pyruvic acid, the reference range here is 7 to 32. So at 6, we're kind of on the low side. So that may be a need for more carbohydrates. It may be a functional need for magnesium as well. Now, remember we talked about fats as fatty acids oxidizing in order to make acetyl-CoA. That high adipic acid tells me that her carnitine shuttle mechanism that takes fatty acids into the mitochondria to oxidize may need more carnitine and magnesium based on that high adipic acid. Remember, fatigue was an issue. Already we have question about the production of energy from pyruvic acid, from carbs, and fatty acid oxidation as well. The high malic acid, I just point this out, malic acid is in so many things that you want your patient to have. Fruits, vegetables, it's a flavor enhancer in beverages. So I'm not as concerned about that isolated malic acid because everything else here seems reasonably moderate. But I'm always looking for those patterns. So speaking of patterns, we already mentioned she could have difficulty with carbohydrate glycolysis, energy production, the high adipic acid and fatty acid production. Look at the low amino acids pattern. Look how everything is shifted to the left. Now, on page 2, it's going to give me a lot of different amino acids to supplement individually. But to my thinking, I'm looking at this and going, what's the pattern? It's really very low. But what's her dietary intake like? If she's eating protein and it looks like this, she's got a much bigger problem in my mind than if she's on a low protein diet. Well, what does the 1-methylhistidine tell us? Below detectable limit. So that tells me that I'm likely dealing with someone who is just not eating protein very well. And as a result, it's low. So maybe it's more about increasing her dietary intake of protein, which would help with energy, the muscle aches. And then speaking of muscle aches, I look at the 3-methylhistidine, which is only moderate. Remember, when it's high, it could be a catabolic change. So not too high, but it does make me wonder, everything else is so low. The fact that the 3-methylhistidine is moderate may actually mean she's a little catabolic and breaking down her muscle in an effort to provide more energy. What about the essential metabolic fatty acids? Well, the omega-3 index is a little on the low side. That's a pro-inflammatory finding, although interestingly, her dihomogammalinolenic looks pretty good, but the omega-3s could certainly use some support. Her omega-9s, a little bit on the high side by percentage. I generally don't have a problem with that. There are anti-inflammatory mechanisms that come with omega-9s. Her saturated fat percentage is in the range, nothing really strong there. And she does have a really low arachidonic acid. So, that can be a problem as well. So what I'm seeing overall here is a need for omega-3s and some imbalances and that low arachidonic acid. What about ox stress? Well, Her glutathione, to me, is a little bit lower than I'd like it to be, right? You really like to see glutathione in the green, so it's just in range. That might be something worth supporting. And then her lipid peroxides are in the yellow. So there's oxidative stress damage. The 8-OHDG looks okay, but between kind of a low normal glutathione and a higher lipid peroxide finding, antioxidant support is called for. The CoQ10 looks fine to me, but as far as nutrient elements, just by direct measurement, look how low her zinc is. Now, I keep going back to, I might want to give her some magnesium, even though it's very moderate, but I've seen a lot of things that make me wonder just based on the patient's complaints. And the toxic elements here are unremarkable. You can see they're all in the reference range. So what do we have here? Looking at this test, I would summarize a moderate antioxidant need, the lipid peroxides, the glutathione, a high need for B vitamins, and that's going to be part of the detoxification, energy production, a moderate need for probiotics. I mean, she's had antibiotic therapy, she's got constipation, she's got gas. The kynureninic acid may speak to inflammation, may speak to oxidative stress. Even though it's protective, it is kind of like an alarm clock. It may also speak to a need for more B6 to help break kynureninic acid down. The moderate omega-3 index also speaks to the possibility of inflammatory changes and the need for anti-inflammatories. The MTBE exposure was a little high normal, and methylation is something that I often think about in terms of detoxification. Remember, it's a water-soluble toxic, and hydration and detoxification. And the carnitine for fat utilization, it seems really interesting how many ways she doesn't have fuel for energy production. Fatty acid oxidation, carbohydrates, and low amino acids. So the carnitine at least can help with that fat utilization. So we had a 42-year-old female, postprandial constipation, abdominal discomfort, difficulty with weight gain, thin and frail, antibiotic therapy, a light appetite. That's not surprising based on her amino acids, very little meat or protein intake, high stress, tired, fatigue, muscle aching. And the nose cycle for the past 6 months also makes me wonder about hormone levels, as well as the muscle aches and sleep difficulty. So I probably want to follow up on that. Her only medication was a multi-mineral. So as far as my treatment considerations, I want to rebuild that microbiome, prebiotics, probiotics, fermented foods. I want a diet that's increased in protein and to incorporate whole and unprocessed foods. I want to emphasize brightly colored veggies and fruits for antioxidant support. I love using foods first and foremost. Omega-3 supplementation, and maybe switch to a professional multivitamin, something of higher quality with, and I keep saying magnesium, that's just my opinion, and zinc. I want to support sleep. And there are many ways that you can do that, but it's, in my opinion, and I think you would agree that it's very hard to get anybody well if they're not getting sleep. And there are things like green tea and L-theanine, 5-hydroxytryptophan, phosphatidylserine that can help. There are a number of ways to help with that, and also getting a look at their cortisol levels. And the carnitine, again, to help with fat utilization. And that's why also the follow-up testing, I would think a comprehensive thyroid and or menopause plus. The menopause plus has an adrenal cortex stress profile, and you can also add CAR to that. But the menopause plus does look at salivary hormones, but the GI effects comprehensive, I think, is a great way to look at the gut. I really want to get a center for gut. I may be dealing with a SIBO patient. I might want to check that. And also an adrenal cortex stress profile with CAR would be nice. Whenever I see somebody with low energy levels, that's something I want to take a look at if I can. So the last part of this, and I know we're going to have Q&A, but there's so much on the website to follow up on. I know there's a lot of information that we went through today, but there's a lot of this stuff is on the website. So if you go to our homepage at gdx.net, you get this homepage and circle clinicians at this blue ribbon at the top. That'll take you to this page. And go to the search tests A to Z. In this case, I would go to N to look at the NutrEval. So there's NutrEval first morning void or plasma. I'll circle plasma. And that takes me to this page, the NutrEval Plasma page. So this is the top of the page. But as I scroll down to this section, look on the right under additional resources. There's so much here: turnaround time, collection instructions, sample reports, patient brochures. But if you look at educational materials, that's how you get this NutrEval interpretive guide. This is a must-have when you're going through a NutrEval. It goes through every section, and it gives you information on every marker. So everything I talked about today, you will find it in the interpretive guide. I highly recommend it. Now, also under educational materials, you can focus on the metabolic analysis profile support guide, which is just digging into organic acids. The NutrEval guide certainly does dig into organic acids, but this gives a little bit more, a little different point of view, which I think is well worth looking at. Another thing that you might want to look at, well, before I even get to that, just notice these test preps. A lot of times we get questions, I'm doing this test, but my patient's on probiotics. Will that affect the test? Those kinds of questions, look at test prep. But under Learn GDX, you get all these modules. So in this case, for the NutrEval, I would go to Nutrition University, and there'd be a ton of information. So I highly recommend exploring the website. We looked at a review of the components of the NutrEval. We discussed plasma versus amino acids, the two types of NutrEval, only based on that one difference. We reviewed that case study and looked at the website. Here are some educational resources to look at as well, but I want to make sure we have time for questions. And again, the lab report. I highly recommend you listen to the podcast of Dr. Devers and Michael Chapman. Dr. Chapman, these two doctors do a great job with a podcast going over individual questions and topics in a wonderful format. I highly recommend it. I was just on vacation for a week, and my wife couldn't understand why I was listening to podcasts. That's what I was listening to. So, any questions?
Yeah, thank you, Dr. Goldman, for such a valuable presentation. And just a reminder to the attendees, if anyone has a question, please put it in the Q&A section, and we will get to it. But Dr. Goldman, our first question is, how does the neurotransmitter pathway reflect the levels of catecholamines in the central nervous system? There's research that strongly suggests the levels of neurotransmitter metabolites present in the urine are not representative of the CNS and are more reflective of the peripheral system, specifically the kidneys.
Well, I think that one cannot assume, based on urinary excretion of catecholamine metabolites, where they're exactly coming from. And there may be research that says more renal, and that makes sense, the kidneys, because that's what you're excreting. But I do think that they are all represented to some extent. I think the 5-hydroxyindoleacetic acid is a good example. When I first started looking at these, most people would message that, for example, high 5-hydroxyindoleacetic acid meant serotonin was being metabolized, and that had to do with the brain. But knowing that 95% of serotonin is manufactured in the gut, I'm going to lean more that I'm more likely looking at what is happening in the gut being metabolized and excreted there. So I think renal function is the key to what you're going to be seeing. I think that the central nervous system is represented, but I don't think as much, for example, for the 5-hydroxyindoleacetic acid, for example, as the serotonin. And I think also the same would be true with the tyrosine to dopamine, that you're looking at excretions, renal excretion, and you can't really extrapolate how much of that is from the brain. I can tell you, though, very often when I've had a doctor talking about a patient on the phone, a patient that may be on L-DOPA, I have often seen elevations in the urinary excretion of the metabolites of dopamine on this organic acid section. So I think that to ignore that there is a representation would be a mistake as well.
Great. Thank you, Dr. Goldman. The next question is, how do you decide between running a NutrEval versus a metabolomics test?
Well, I think that they're very similar in that they have very similar sections. The metabolomics does have the advantage of you don't have to do a full blood draw. That, you don't have to have a phlebotomist there, and I think that's great. I just think there's more information in the NutrEval because, and it also will depend on how you like to look at your nutrients and your toxics. So, for example, on the NutrEval, when we look at toxics that we just looked at, we're really like lead and mercury and the like. We're looking at it through whole blood. So we're looking at a wider window of exposure time, probably, more like 3 weeks, maybe 4. Whereas if you decide to do a metabolomics with just urine, you're looking at a much shorter window of exposure. With the metabolomics, you will look at only a first morning void amino acids. If your preference is to look at the plasma for a longer steady state of the amino acids, that you're going to need the NutrEval, whereas the Metabolomics Plus is going to provide you with just the first morning void, which is, again, very valuable, but just different depending on the data that you want.
Excellent. Thank you so much. Well, that's all the questions that we received. So, Dr. Goldman, thank you for a very valuable presentation, and thank you to to the attendees. Just a reminder that the presentation has been recorded, and you will be sent a recording. So if you want to go back and rewatch, because there was so much great information, you can. Otherwise, thank you for joining us. And if you have any last-minute questions, put them in the chat function, and I can send them to Dr. Goldman. Otherwise, have a great rest of your day.